first one, it takes a while for people to realize that we're rolling, but I'm glad that all of you arrived here. Expect an interesting evening. Everybody who comes here, whether you're an existing patient or not, you always come with interesting questions, knowledge. I know that you're looking into these things well ahead of the average person in the community. That said, it's not Stump the Doctor night. But if there is something that I don't address, I'll get the answer back for you. And then just before everybody came in, we were talking a little bit about, let's say, some wish lists people hope I will cover. So I do want to ask, do you have things that you want me to address? And if it's within, the ability to do so tonight, I'll go ahead and do that. So does anybody have anything on their wish list that they want me to address? So far I've got on the order of what to take when. I take certain things. Can I take them together? Should I take them separately? That kind of thing. The other question was about, we do a lot here to address stomach and digestion issues. So how to take hydrochloric acid, digestive enzymes, and probiotics. And so anybody have anything specific? And if I don't already have it in the list, yes, ma'am. Probably I'm not going to get into that too much, but I can address it in general. So the question was about anabolic and catabolic nutrients, what to take when. Are you speaking more in terms of athletic?
No, I've just been told years ago that it was wise to think about taking some nutrients because they support when you're sleeping.
Oh, okay.
Okay.
So the clarification was what to take when let's say you're going to bed at night versus things to take during the day, another timing of the day. Yes, and I can definitely do that. So I do want to say though, for those that might have come in or maybe you're feeling shy, feel free to enjoy the snacks. They are organic, gluten-free, and so and I don't know if we'll do this every time, but certainly the first night we kick this off. And supplements that are available to you to take home with you, they happen to be behind me. So, if you feel too, you need to stretch your legs. I think it's a small group. We can be a little bit informal here as well. So, and definitely there are things to drink there. They're all good for you. The calm powder, now if you go ahead and do that, that's magnesium. So it can make you a little bit relaxed. So maybe not the best thing to drive home with tonight. So, but later on, definitely before bed. So I've done various versions of this talk over the years that we've been doing the Tahoma talks. I think I counted several versions of this, depending on what we're doing. And so what I want to address tonight are some of the basics. And many of you may be far more advanced than some of the basics here. But I kind of want to lay down a framework with regard to supplements because even in doing research for this, looking back at previous discussions, a lot of supplements have a bad rap. And I don't understand it. And I was also motivated last week when I had a number of patients come in and say, and I won't say the class of doctor that does this, but basically, they're not naturopaths who kind of sit down with you and to say, why are you on that, and why are you on that, and you don't need that, and this is bad for you. When in fact, many of these things, and maybe you find out for yourself, really help you heal and get better very quickly. So I don't understand the misunderstanding about supplements that's out there. And in fact, all modern drugs are derived in some way from some type of natural product. Herbal medicine goes back to the beginning of time, probably even Neanderthals and even the newest non-human form that they found was, and I forget the country where they found that particular, one of our early ancestors. They probably were using some form of herbal medicine too. In fact, if you watch animals, you watch how cats will eat grass, for example, when they want to throw up. Or I've seen horses do this. I've seen dogs. All animals have some knowledge of what makes them feel better. That's innate knowledge, and it's actually called pharmacognosy. which when I was in school, we actually designed a little bit of an approach to using this and studying our innate ability to choose things that make us feel better. As modern adults in this modern world, we've forgotten a lot of what we evolved with. Or it's been trained out of us, is not to respect those things. But how many of us think about something and we go to the cupboard perhaps and we grab the very thing that's going to make us feel better without knowing why you're even selecting it? So I want to take us back a little bit and realize that this has been part of our history since we evolved, began to walk upright. And so, in fact, the Sumerians, and they were 4th century BC, they recorded the use of opium, thyme. I was really surprised about licorice, but we know that licorice has many different uses, and also mustard. Those were several of the things that were mentioned. And we're probably very familiar with the use by Native Americans and settlers and what things that they used. Willow bark. We still use willow bark today as a substitute for aspirin. In fact, you have to be very careful with willow bark. Treat it like it is aspirin because it can cause some of the same effects. It can affect the gut, possibly even leading to ulceration. And then digoxin or foxglove. Every year we see foxglove, growing around here. But early settlers, Native Americans, used digoxin, or actually in the form of the digitalis, the plant itself. So this is not new, and this is something that I think is hardwired within us as something that we do innately. If we would, allow some of that. In fact, looking at some of this, you start to think, well, how long ago did we understand the use of minerals and other supplements? And I think this one is interesting. We essentially what we feel is that all of these things are gone. Scurvy doesn't exist, beriberi, rickets, none of these things exist, right? The fact is, medicine is actually seeing some of the resurgence of some of these things because of the changes in our diet and the way we approach taking supplements and our nutrition, excuse me. So it's probably known to you that over long sea voyages that many sailors develop some of these deficiency states, including scurvy. It basically affects the bones, and taking lemons and oranges, in particular James Lind found that when they received lemons and oranges, they were better. Those recommendations were hard fought after they did this particular study, and even the United States didn't accept it for, gosh, isn't that 100 years later? Yeah, we're still doing that. And so essentially then it wasn't until 1913 that they started to realize that there were deficiency states that were occurring. And then in 1928, one of the first vitamins was identified, or vitamin C, which we know is what they were studying in the first place with scurvy. And so that did begin a process of understanding and looking at different minerals and supplements that were important to overcome deficiency states. But in many cases, some of those arguments are still going on. How much is appropriate? When should we take it? That type of thing. So question I want to pose to you all is, why take the supplements in the first place? And essentially, even though there are reasons to do so, it comes down to you individually. Why do you want to take something? What are the disease processes, deficiency states? What type of health or optimum health do you want to achieve? That's individual. I can't answer that for you unless you're showing some kind of disease or pathology. Were you exposed to environmental toxins? Do we need to work on things like chelation or other types of supplementation? Where did you grow up? Where do you live now? What type of food do you eat? What is the mineral content of the soil from which that food is coming? We are seeing that there are depletions in trace minerals in many areas. And so that affects then your ability to gain the nutrients out of those foods. transport and processing. You know, how many of us, you know, it depends where you shop, of course, but how many of us see, you know, green tomatoes sitting there to be ripened, or bananas that are green, or things that are no longer coming in ripe? It used to be, and it is still this way in some, you know, markets in Europe and various places, and I would say for sure some of the farmers markets where things are brought to market exactly when they're ripe. And that's the way it should be, but our ability to get things transported is very hard. I even saw, I don't know if this ever came to pass, that they were working on developing square tomatoes so they'd fit better in cases, you know, that kind of thing. So those kinds of things put pressure on our food supply, affect the nutrient value. And in fact, I was hearing on the radio recently that there is a resurgence in people planting their own, you know, let's say gardens and growing their own food. Not only concerned because of the prices, but also because of the quality of the foods themselves. I'm part of a CSA, a community, you know, agricultural group, and you have to love zucchini, though. If you're going to plant things, you know, I've got way more zucchini than 2 little tomatoes. So, but it's wonderful for the quality of the food, and also you can trace it from where it was planted, making sure it wasn't used with any kind of pesticide, right to your table. And it's hard on the scale of our lives these days, but that would be what would be ideal to get the best nutritional value from the food. And so this kind of goes back to what I was saying. Think about what you're trying to do. Are you prone to getting infections? Do you want to, you know, improve your longevity, either familial or other aspects of longevity? Do you have known deficiency states? For example, you know, on testing, do you have low vitamin D? On testing, do you have a deficiency of vitamin B12? You know, do you want to strengthen the immune system? Do you find yourself getting colds and flu each year? That type of thing. Or do you have any kind of metabolic processes that need to be improved? It's said that every one of us has some type of pathway that is actually not working up to par. And it's different. We have our own biochemical individualities. And so that's why, let's say, one of you might be able to tolerate a certain supplement and maybe I cannot. Or my need for it might be twice what your need for it is. So that's what makes this hard. And this is what makes some people throw up their hands and say, I don't know, so don't use it at all. But I can say that, you know, based on my seeing people over the years, that supplements do appear to me to benefit people in all of these ways, and in terms of their, not only their immune processes, but their longevity. I see improvement. So I would never go the other direction and say, no, you should never take these things. So before I go on, any questions so far on things that I've said or anything brought up, any thought? It's okay to jump in. So not all supplements are created equal. And I'll even go as far as to say even the ones in our dispensary. Now what does happen down there is based on all the doctor's input, Dr. Wright, the dispensary staff, we try to bring in those things. And I don't work for them, by the way. I'm a doctor in the clinic. But I use those things all the time. So we try to bring in things that all of us have agreed upon is good, or we trust those that are bringing them in. But oftentimes we will find different sensitivities to people on those different supplements. You know, one type of magnesium might work for somebody. One type of vitamin D might be better. It isn't quite as cut and dried as that, but some of it goes down to, and it's at, I'll jump to the bottom point here. For example, a lot of supplements are based on additives that include magnesium stearate. Magnesium stearate is in supplements to keep it going through the processing, so they run it through the machines to keep it running through the processing very smoothly. But you take that out and it'll tend to gunk up the machines. And I'm going to go ahead and mention the one company I know that doesn't include magnesium stearate at all, and that's Thorne. And they're actually in Sandpoint, Idaho. They actually do not use it in any of their products. And they have to live with a higher rate of failure of their processing because they don't use the magnesium stearate to improve that flow through the machines. Stearic acid, you'll see a variety of things, some of which are totally inert, and some of which you really want to look at to be sure that you're okay with. You know, I've picked up a bottle thinking that I'm not giving someone anything containing soy, and there it is right on the back label. So you have to think about that, your own sensitivities, and that goes back to the additives contributing to food sensitivities. This is the one time when I'll see a treatment failure if I give something or another doctor gave someone something that actually was something that somebody was sensitive to. Kind of going to why organic, non-GMO, even though there's a lot of talk out there related to a certain company and they're wanting us all to be eating GMO foods, there is also research out there that shows one of the big side effects, and there are not many studies because I did the research, that GMO foods can contribute to gastrointestinal symptoms. And I have patients that have to come off GMO type foods because of it, and we've seen great differences. So your food allergies play into everything that you're using and taking. You want to think about, is this correcting for a deficiency, or am I wanting to improve my energy in this case? Therapeutic versus food grade. So I would say almost everything that's in the dispensary downstairs is actually therapeutic grade. But many things that you encounter in food grocery stores are actually food grade, meaning they're not as strong as some of the therapeutic grade supplements. So you also want to look at what the milligrams, what the dose is per supplement. So don't be fooled by that. You want to look at the capsules that are required. Let's say it's recommended to take 2 capsules. What that means is everything under that list is contained in 2 capsules. Not 1, but 2. So if you only take 1, then you're going to get half as much as is recommended on that label. So that's important, because if you continually take supplements that are not strong enough, you may not see the therapeutic effect that you expect. So you also want to pay attention to how things are made, what are the active ingredients, and under good manufacturing practices. This is big out in the news too, and so that how are these supplements made? Do they actually contain what they say they contain? So I would say too, all of the companies, now I know we haven't tested it, this goes based on reliability, but I'd say every one of those companies in the dispensary does follow good manufacturing practices. But there are plenty of them out there too. I'm not saying that that's the only location for those, but you do want to be careful of those kinds of things, because you can end up spending a lot of money and not getting the benefit. Does that make sense so far? Any questions on that? So how do you go ahead and create a good supplement program for yourself? I recommend this. I know we're all able to read labels, we're all able to do all of these things on our own, but at the same time, to get certain effects, what you may want to do is talk with a doctor who knows about these supplements and how to combine them, because there are times that certain things should be taken. For example, I'm going to give a couple of generalities. When you want to take something to help support energy, let's say you have an adrenal fatigue, chronic fatigue. Well, chronic fatigue is a more specialized constellation of symptoms. But you want to take something that helps improve energy, like an adrenal support, thyroid, in the morning. And you want to take it, let's say, first thing in the morning, noon, never later than 4 p.m. So if you take things that help support energy later than 4 p.m., it can contribute to insomnia. So you want to take those earlier in the day. Trying to think of other examples here. Somebody asked me earlier about the probiotics, so I'm going to go into this a little bit later on about the digestive enzymes and so on. But let me also give you a scenario of how to take something based on the hydrochloric acid, digestive enzymes, and probiotics. So we'll do testing to see whether somebody is producing enough stomach acid and there are constellation of symptoms, let's say reflux, gas, and bloating, that indicate that something else might be indicated. So when you go to take hydrochloric acid, and I'll explain this a little later, you want to take it at the beginning of a meal, so a beginning of a major meal, but with a little bit of food. Then when you go to take a digestive enzyme, and I know the labels on digestive enzymes say different things, you want to take it 20 to 30 minutes into the meal if you eat slowly. If you eat fast, you take a digestive enzyme at the end of the meal. It matters when you take things. And then a probiotic, I like people to use probiotics at night because the body is actually cleansing at night. So I aim certain things at that time of the day. So let me explain a little since I jumped into hydrochloric acid. Many doctors out there feel that, and I'm going to say the conventional doctors feel that reflux, gas, and bloating is a sign of too much stomach acid. After doing umpteen million Heidelberg tests, working with patients, I can tell you I almost never see that to be true. So when we test, we will find people who actually have low stomach acid. And so then when we work on improving the digestion, we'll find that we can add stomach acid in and their symptoms improve. Reflux goes away, gas and bloating will often go away. So it's because the stomach actually needs a very low pH of about, let's say, 2 in order to work properly. That's when proteins are being broken down. And it triggers then a hormonal reaction, triggers the release of digestive enzymes, which then are actually absorbed or put to work at a higher pH or more neutral. So that's why HCl more acidic at a beginning, digestive enzymes later at a higher pH, and then probiotics could be taken after the meal or later in the day or at night. So when you take things actually does matter. There was
so
the...
if you forget to take the digestive enzymes after your meal, it's not beneficial to take it like an hour later when you remember. It's
So-
just too late. Wait for the next meal.
So the question is if you forget to take your digestive enzymes, is it too late? Forget it and take it with the next meal. So the answer is it depends. Now, if at the end of the meal you remember the HCl and you just finish eating, you could sneak it in there. So that's the strong acid. I've had people do this and they tell me that it creates burning. So my recommendation is if you forget the HCl, forget it till the next meal. Digestive enzymes do work at a higher pH. So if you forget it and it's the end of the meal, you could add it back in. If you add it in an hour later, it's no longer working on digestion. It's actually working in a different way. It's helping to reduce inflammation. And we use it that way to reduce pain in the body. So it's got a different effect. So I'd recommend kind of working it in during the meal if you can. Yeah. It's not wasted, but it's going to have a different effect on the body. So now I think somebody here had a very specific scenario. Do you want to ask that question about when to take things?
Is that me about AM versus PM type nutrients?
Okay. So the question was about AM versus PM nutrients. What I try to think of, and this may or may not answer it specifically, it's back to the energy again. I like to think of things that are going to promote energy early in the day, to take them early in the day. But you can take almost all supplements early in the day, including vitamin B12, folic acid, magnesium, vitamin D. You can take all of these things in the morning to help support the day. Some of these things you do want to take in divided doses, so maybe not all of it at once. But you can split it out. You can take many of these things at noon. You can take many of these things in the evening. The kinds of things that I like to suggest to take in the evening are things that are more calming, more supportive. Let's say magnesium, because it's more relaxing. This is when I like the probiotics. Depending on whatever else is going on, maybe tryptophan, maybe other supplements like that that are supportive. Maybe you would take SAMe then. You might take tyrosine. But anything that's more energizing, you want to take earlier. Anything that is more supportive of sleep and calming, you would take later in the day. I know that's very general. Yeah. Yeah, so it is a lot to learn. Essentially, though, think of things like vitamin B12, B12 with folic acid, B vitamins in general. Keep them early in the day, not late, because they can contribute to insomnia because they're designed to actually create energy in the body. And there are some exceptions here. Yes, ma'am?
Kind of related to the discussion about timing of stomach acid and digestive enzyme, is there any other guidelines about the timing of taking supplements if you are taking HCl? I mean, is there anything like if you're taking your stomach acid front into the meal, spreading supplements out through, or does it really matter? Does it matter
Okay.
the timing?
A good.
Or other things for taking vitamin D3
Okay.
or
Okay.
vitamin C or something else?
It's a good question about timing of when to take supplements, let's say even in and around taking the hydrochloric acid and digestive enzymes. So a lot of individuals actually, when they start their day, they will actually take their supplements with HCl as well. I want to give you a rule of thumb though. Supplements are not the replacement of food. They are cofactors for food. So if you're taking a handful of supplements and running out the door, you're doing it wrong. You got it. It goes with food. So the cofactors help those physiologic processes work. Things like B6, niacin, all of these things help make these processes more efficient. So even if you're taking supplements early in the day, add some kind of a food basis with it. But a very strong indicator of a problem with digestion is when people take supplements and it doesn't settle well, or they get nausea, or they're sick from it. That's often a red flag that the digestion is off. And so that's where we start to add things in. Now I'm mentioning hydrochloric acid. You might also hear it as betaine HCl. There's a product over here as a sample of, actually it's the Floridix iron version. I don't think the digestive aid is here, but Floridix does make a digestive aid as well that can be substituted, so you don't have to go to HCl. But essentially, if you're having that problem, then digestion is off, and so you want to time it with your hydrochloric acid, whether before or after the meal. I'd say a lot like the digestive enzymes, take those supplements more toward the middle of the meal so that you've got something there to work on them, to break them down. Or at least make sure that you're having a meal with them at that time. See if that works. I don't know any other prescriptions regarding, what to time with what. But by taking the HCl at the beginning and not taking the digestive enzymes at the beginning, you're not denaturing them. The digestive enzymes, the way they work, they're released from the pancreas. And they're released at a higher pH, a more neutral pH, than the hydrochloric acid. So when supplements say take them at the beginning of the meal, they're actually causing you to add them at the wrong timing in the body. And I've had people come in doing it exactly opposite. So you want to take the HCl first, then the digestive enzymes, then add your supplements in. Most likely that's the way to go. Now there are a couple of types of supplements to avoid taking at the same time. If you're on some type of an osteoporosis, a natural osteoporosis medication, containing strontium, you don't want to take it at the same time as calcium. You need to separate that. And amino acids, sometimes certain amino acids are given for therapy, like glutamine for stomach issues. So if it's an amino acid that's intended for a specific therapy, take that away from food. Otherwise, its intended effect will be neutralized. Did you have another question on that line? It looked like it. Okay. Okay. Yes, sir.
Regarding the timing of the enzymes, proteolytic versus digestive, if I may, on one particular product in general, LDF,
Okay. Okay.
puts out an extraordinary enzyme without amylase, but they
Okay.
want you to take it right before your meal, which, listening to Dr. Wright and everything I've read, I'm like confused. I mean, I've
Okay.
called them, I've asked them, again, why before you put any food in your mouth, just before, and I'm wondering if that works.
Okay. So the question is, there's a certain life extension product that doesn't contain amylase, but they're telling you to take it before the meal. You know, I'd have to look at it. I've read some of those. People have brought them in to me, not that exact one, by the way. Everything I know about the way digestion works, the digestive enzyme should be taken in the middle of the meal. In that particular scenario, I'm wondering if they have something chelated to an HCl or something like that. I don't know. It doesn't have anything.
It has all
Okay.
this for digesting fats and proteins
Okay.
and carbohydrates.
Okay.
And I've called and it's like, I have no understanding.
Really? Okay. Basically he's saying that he doesn't understand it, and it flies in the face of everything we're saying, and that Dr. Wright has said also,
And what I've read.
and what you've read. If you
Extraordinary enzymes.
okay.
That's the name of the product, and it's, they put out a couple different ones, but that one.
Okay. So it's called extraordinary enzymes. The reason I repeat the question, by the way, is for the listening audience that's not here. Why don't I look into that, and I'll see if I can get you an answer. And does Devona have a way to reach you? So I'll see if I can get an answer. Will you accept an answer that I get through Dr. Wright, perhaps? Will that be a good substitute? Okay. 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 Now what I'm saying is, if I can't reach Life Extension myself, I'll go ahead and find out from some of our doctors as well. But my understanding of the way the different enzymes work, you want them to work under a more neutral pH. So, yeah. Yes. Okay.
I was wondering about the glutamine you were mentioning. If you're taking that for leaky gut, to solve a leaky gut problem, you're saying not to take it with food?
Correct. So the question was about glutamine, which we do give to address leaky gut. It does help. You know, all the enterocytes of the digestive system actually use glutamine as a food source, so it does help improve that. So the question is, should it be taken with food or without? The answer is it should be taken away from food for that purpose. Most of the time we give it on an empty stomach at night before bed. Yeah, and it works most effectively that way. I don't. Yes, ma'am.
Dr. Russell, could you, I've seen some Amory patients over there, and they might have like a handful of supplements that they take per meal, and they drink them down with water or juice or something like that, thereby neutralizing the stomach acids. Do you have some suggestions where they would, because by the time they finally are able to eat the food, they're actually full and they're bloated, and I've tried to train them how to just not drink something with their meals and just take a bite of food and get into that swallow reflex and then pop a couple of capsules or whatever, swallow it all at once without drinking anything. Do you have a suggestion?
So the question was that in a particular scenario, she's seen patients drinking a lot of water with their supplements, and then by the time they get to actually eating something, then they're full. Um, sometimes it's very hard for people to just swallow. I for one can't. If it's not one at a time, I can't do it. Although I've seen some of our doctors swallow 15 at one time, so more power to them. So sometimes it's really hard, but I think what I'd recommend in that scenario, again, back to the point of many people, who report that they get reflux, gas and bloating, nausea, sick to their stomach from taking supplements, I would say they should start eating first. Back to the cofactor scenario, if they never get to the food, those supplements, while beneficial, will not be nearly as effective. So start eating and then use as little liquid as possible in that case. At least you'll be getting them into where they're acting like cofactors, not the excuse for the meal. That it may be hard to retrain people in other ways, but and I know that I can't do it, so I can't quite tell everybody to do the same thing. But you're right. But the idea is get them to eating some food first, unless in terms of your protocol, is that not okay to do?
So
It's okay to do. Okay. Okay. Yeah, recommend to start out with food first, then add those in later. Yes, ma'am.
I found, because I used to take a lot of supplements, and I think I was got towards Harvard. So I sometimes will do, we're having soup, I'll make sure I pour
Yeah.
my supplements down in soup, or yogurt, or
Yeah.
for instance, kefir with blueberries.
Yeah.
Some type of a food, but that's a food that's either soft or mashed potatoes.
Good idea. The suggestion was to take them with soft foods or a soup or a yogurt. And it reminded me of something that I do. You could also think about the calm powder over there, which is magnesium. So if you need to be taking a supplement that's a powdered base, you could add that in. I used to do my powdered vitamin C with my supplements. So I'm drinking the C, small sips along with the supplements and getting everything in at that particular time. So that's another way to go with it. Good thinking. So obviously a lot of questions on how to take supplements here. So let me cover a few of the basic ones. I'm going to cover what are many of my favorites and some of what I consider the most important in any particular diet. So vitamin D3, there's a lot of discussion about D out there. After a lot of good research, people saying, this is the panacea. Now people are trying to backpedal and say, no, we were wrong. They weren't wrong. They just, I think different groups are realizing that people are taking many of the recommendations on D seriously. So we find here at Tahoma Clinic, we will often recommend some high doses of vitamin D and vitamin A when people are sick. I'm not going to tell you how much. I really, don't want people indiscriminately using a lot of vitamin A. But at the same time, I can tell you that D and A are very helpful in helping to help support the immune system. And I have a 70-year-old patient who came in the other day and said, ever since I told her to do vitamin D and vitamin A, she hasn't been sick. And so that compared to where she had been, that's saying something. So vitamin D is not only a vitamin, but it's actually more of a hormone, and it influences many different aspects of health. I find that it helps improve the cell's efficiency in terms of absorbing nutrients. It influences many different gene functions and is in fact important in terms of the brain. It's actually used in many different cases to treat cancer, and this is in a conventional setting. Many times people will be given high doses of vitamin D. We know that it helps prevent flu and cold. It's important in terms of bone health. It does help reduce blood pressure. So many things, obviously, that you can see. Typical dose, now it's going to depend on your own value. I will give you an average amount that we recommend here, and that's about 5,000 IU per day. Now, many people take far less than that, and that's way more than the RDA. But what we find is in almost every locale, almost every latitude, you will find people are deficient. They're not absorbing D very well. So we aim for the tropical optimum. And so that means it's at a higher value than basic. So if you get labs back and you're on the bottom tier, you're like at the lowest level, your doctor says you're fine, I would beg to differ. So, yes, sir.
What's the upper limit of taking D?
Okay, so what is the upper limit of taking vitamin D? Some of it's going to depend on your own individual number. Like if you're already at an optimum level, then that might be in that case at the 1,000 IU. But typically the range we give is, let's say 5,000 for most people that need it, 10,000 in certain circumstances where it's low, and up to 15,000. You don't want to stay at 15 to 20,000, though. That is actually too high. So that is if I have a reason why somebody's there. Let's say I'm trying to help support their immune system, or they came back with an extremely low value. I'll bring it up, and then I'll bring it down to where we're at the tropical optimum. So much of that is individual, but it's probably no more than 5 to 10,000 IU per day.
If I may?
Yes.
With my mother, the osteoporosis doctors, you had a certain amount you took
Mhm.
a day. They were giving her a 50,000 unit pill
Yeah.
once a week.
Yeah.
Does that work versus taking it a certain amount daily? I mean, it
So-
seems like you've got one shot there, and if you don't absorb it, you're kind of like...
So good question again. He said his mother was taking vitamin D for osteoporosis, and conventionally they were giving 50,000 IU in a bolus a week. It does help in many cases in a lot of people. But if you go and you do the research and you look into it, the body detoxifies vitamin D better on a daily basis. That's why I like it to give it daily. And I have seen the numbers come up very, very nicely that way. And so that's why I like that. And to the point is if you have any degree of malabsorption, for all these supplements together, you may not be absorbing them very well. And so back to, again, when we're talking about hydrochloric acid in the stomach, the failure to absorb nutrients is one of the biggest factors behind osteoporosis. And vitamin D is an essential cofactor in terms of bone health. So it depends on the individual, again, what the upper limit is. But giving 50,000 IU at one time is an accepted practice. They're not giving it every single day. So that's why they're doing that. I like the daily approach if it's registering that the D values are coming up. So, yes, ma'am.
What does too much vitamin D do to your body?
So the question is, what does too much vitamin D do? And are you asking because you are thinking of symptoms that are related to that, or?
Yeah, I've taken it at high doses for a long time. I haven't done my blood work yet, so.
Okay. So the question is she's taken it at high doses. Actually, while we're on the topic, I want to go ahead. Oh, it's right here. And point out a book that I highly recommend for people to look into with osteoporosis, and it's called Your Bones. And it answers so much you want to know about osteoporosis. It's written by Lara Pizzorno and Dr. Wright. And it was coming from the point of view where Laura was actually, she had osteoporosis and she wanted to reverse it. So this is a really good read. But there are basically different signs of toxicity related to vitamin D. It can adversely affect calcium levels, for example. It can affect parathyroid hormone. So I would say.
And I was taking it more for immune.
Okay. And you can.
Told me that I could take 20,000 a day, and I've been doing it.
Okay. So the comment was she's taking it for immune support, and she's been taking it at 20,000 IU. And I would definitely recommend that you, for a long time. Okay. And she hasn't gotten sick. I would still measure it to see where you are.
Yeah.
So to make sure that that's not too much. Dr. Joseph Pizzorno, her husband, Laura Pizzorno, was one of the founders of Bastyr University. And he did some writing recently that's in the literature, and he said 20,000 IU, he did say is too much to do long term. So you might look into that. So it can affect bone health, it can affect a variety of other things. So so I would definitely go ahead and test it. So just to make sure where your levels are and bring it back down to where they're normal. So, golly, I had no idea supplements could be so exciting. So another one of my favorites is magnesium. In fact, when I first started in practice, you start in practice and you don't know a lot of the effects of a lot of things. You've heard about it in theory. So I gave everybody magnesium. It was just my favorite thing to do, and I still do, but now I approach it a little differently. So magnesium is important in many different physiologic processes, and ironically, it's not available in many foods at all. And so, in fact, one of the best sources is actually in different mineral waters. Gerolsteiner water, for example, German mineral water, is highest in magnesium. And essentially, it's very important for muscle function, for reducing, in fact, how do I explain it? It reduces spasms. So I've had patients come in and they have esophageal spasm, or they have other types of spasms. And magnesium is relaxing to smooth muscle. So it's good for the heart, it's good for muscle anywhere. If you work out and you come back, tired, crampy, the magnesium is helpful for relaxing that. And my favorite form is actually Epsom salt foot soaks. I wrote that on the end there. And I say foot soaks. A lot of people don't have bathtubs these days, but you can actually soak in it and you'll get a systemic effect. And this was interesting. Epsom is the name of the gentleman who created Epsom salts. And he did it because people couldn't always absorb magnesium through other forms, so they can absorb it through the skin. It's a magnesium salt. We have the powder over here for you to try, the calm powder. It's relaxing. A lot of people use that, let's say, to promote sleep. I have sometimes with people who have a little bit of anxiety, I'll have them sip it during the day. Magnesium oil. Now, magnesium under pressure becomes an oil. It's not that they added oil to it, but you'll find that there's a vast range of different nutrients also available with the magnesium oil. And you can apply it anywhere to pain to reduce areas of pain. It's not as effective, let's say, as a painkiller, that kind of thing, but it does help with knee pain, joint pain, headaches, and I like to recommend it to people that may have a little bit of an arrhythmia or blood pressure issues, to apply it on the chest over the area where the heart is and the great vessels, because it does help. The added benefit of magnesium oil and Epsom salts is it doesn't cause any kind of diarrhea, at least in small amounts. I had somebody apply it all over her body, and that did cause a problem, so don't do that. But it comes out of the bottle very thinly, and so you can actually get more on your hand than you realize. The oral form is the one we need to be a little bit more careful with regard to diarrhea. And the way it's worded is you take it to bowel tolerance. There isn't any toxicity to magnesium, except that it shows up in terms of diarrhea. And that's why I mentioned supplements earlier that might contain magnesium stearate in that. Is you're getting the same kind of effect with too much magnesium. And part of the motivation with some of the supplements and these talks is early on I had people coming in very health conscious, and they were on as many as 50 supplements a day. Now there may be times when that's appropriate, but I think that's overkill. So what I'm endeavoring to do is to kind of guide people now to seeing supplements to take that meet a lot of objectives. So they're not taking everything that's seen. In all due respect to Life Extension and other magazines, they're great. They are advancing knowledge. They do an excellent job. You don't want to choose every supplement in Life Extension and take them all. You've got to be very judicious. You know, I have many patients come in with leaflets and say, I want to order this, what do you think? And so no, then we go down through it and we find out the reason they either should or should not. You want to be that careful with supplements because it's really easy to get yourself in a state where you're taking too much. And I've had many people do this. The reason I'm mentioning this with regard to magnesium, it's the magnesium stearate. What we do is then when the diarrhea shows up, start to back the supplements out. The last one they took, back it down. Oftentimes go to a supplement holiday and stop taking anything at all, then adding back things in to make sure that there's no diarrhea. Sometimes we don't know what contributed to it, but that's what I'm saying is when you start to add things in, you know, I've got this symptom, I've got that symptom, you know, 40, 50 supplements, it's too much. You need to simplify that. Yes, ma'am.
Just a question on the Epsom salts and the foot soaks. You know, you take Epsom salts in the bath, so go in there for a period of time. But
Okay.
what's the absorption rate? How long of a foot soak?
Okay.
Between Epsom?
Good question. How long?
Yeah.
Generally, I recommend 20 minutes.
Okay.
You can do that more times through the day.
Yeah.
You know, and you can definitely do it in a bath. I typically recommend about a half a cup to a cup, you know, depending. And I do this myself. I love it. It does help improve circulation. It's good for venous insufficiency. I even use it when people have, let's say, a stasis ulcer. They've got open skin and we want to heal. I've seen it do a really nice job. It does help reduce blood pressure. Again, you don't want to use this as your acute phase product. But we have people come in here too and we give them magnesium pushes so they're getting a quick bolus of magnesium. It drops the blood pressure. It's excellent for migraines. I don't want to gloss over that. This is wonderful for things like migraines. And if you go into a conventional ER, more than likely they're going to give you some magnesium to drop the blood pressure too. So these are many of standard therapies out there. That's why this is one of my favorite in so many ways. It actually helps reduce constipation. It helps reduce arrhythmias. And so, in fact, I had a woman come in. This is, we had been using this for other purposes, and the arrhythmia that she had went away, and also something had been detected on thermography, so we do evaluations of breast health. And that item on thermography went away too, so it seemed to have reduced inflammation elsewhere in the body. Again, it has its limits, it's just a supplement, but it is very many applications.
Is that like 1 cup of Epsom salts for soaking?
So the question is it 1 cup? It depends on how big the basin is. I'd say between a half and 1 cup. Look and see how much that is and see, you know. I'll recommend also rinsing off because magnesium can be a little drying. So maybe just as you soak, then rinse off. And for people that might be listening, elders or people with mobility issues, I'm not telling you to sit on the edge of your tub or do anything dangerous. Sit somewhere where you're stable. Bring the basin over there. If necessary, have somebody else put the water in. Very safe therapy when done right. Dry off before you start to walk away. You know, just common sense on this one. So very effective when properly done. Any questions on that? You can tell I'm passionate about magnesium. So the question is if you use it for migraine, you know that it's going to vary depending on the headache, if we're talking the capsule form. Okay, I do want to mention one other thing. Thanks for asking the question. So if you want to know where your bowel tolerance level is and your effective dose, start titrating up. So add a capsule. I recommend a low dose, and I'm going to be specific here. I like the low dose capsules that Thorne has. They're about 130 milligrams per capsule, but there are plenty of other vendors out there with a simple magnesium. And so then start titrating up to see, so go 140, 280, keep going. And if you develop diarrhea, then back it down. That may help you to identify what the effective dose is for the headache. I do this all the time for folks at night for bed. Magnesium is fabulous for helping with sleep. It doesn't work in everybody, but it helps many people. And that's because it actually relaxes the smooth muscle again. So it creates a very subtle relaxation. So for the headache, this may be the time to actually use it at night before bed. During the day, maybe think about magnesium oil because you can put it on the temples. You can apply it in various places for absorption. And Epsom salts, because of the heat, help very much. So you put your feet in warm water, and I would say, again, to tolerance, it actually helps improve circulation, and it helps, ironically, to bring heat out of the head. I call a headache hot or heat. It helps bring it down. So that's what you want to try to do. So I guess there were more mysteries about magnesium. Yes?
Do you have a certain form of magnesium that you prefer, like citrate or aspartate?
Very good question about forms of magnesium, and that's really important depending on bowel tolerance. I prefer citrate because it's the most absorbable, but you can use glycinate, you can use all of the different forms out there. I tend to walk away from forms of any supplement that are ascorbate. I tend to avoid those in those cases, but sometimes they're a little bit more irritating. But the citrate, glycinate, oxide, see which one works best for you.
So I have a
yes, ma'am.
teenager who just gets off sleep schedule.
Okay.
16, he doesn't really want to take supplements, but I'm trying to get my kids healthier. So for sleep, would it be 140 milligrams? Would that be something I could give him at night?
So the question is about supplements for teenagers. This is not uncommon, by the way. They don't want to take any. So I have a number of young patients, and I negotiate with them. So what is the desired effect that you want? And so if you take this, this is the intended goal. Will you do that? And I do that with all of them. And it tends to turn around about age 30 when the problems start to occur. So I would first suggest working with them. This is the intended goal. Can I give you this?
And how soon would I see a result for sleep?
You know, it's going to depend. It depends. I would start with the 140, and you could work up if he's willing or she's willing to do that.
And I notice a difference in a couple of weeks, or is it something that has to build in?
So the question is how soon. You know, it's going to depend. It isn't one of these things that you got to get to a certain level. So you should see some relaxation fairly quickly with it. To get to where somebody is sleeping better with it might take a few days. But again, the biggest obstacle I see isn't the supplements working, it's getting them to take them.
Yeah, no kidding.
Yeah. So, all good on magnesium? We're going to be here till midnight with this. So no, but it just says it's important, and there's a lot of information that isn't out there on some of the supplements too. Vitamin C, now I covered that a little bit at the beginning. I love vitamin C also, and I'm going to tell you the typical dose that we tend to recommend here. And it's 2,000 to 3,000 milligrams per day. For many different reasons, for its importance in the immune system for sure. In fact, vitamin C is actually a very important, though weak, adrenal support. So on my hierarchy of therapies, I will add in vitamin C first to help support the adrenals. So if people are tired, not functioning well, in fact, sometimes fatigue is what first shows up as a sign of deficiency. Another very important one, whether it's for yourself or an elder or family member, easy bruising, nosebleeds, these types of things that show capillary fragility can often be low vitamin C levels. And it shows up in more discrete ways like joint pain, poor wound healing. But first line of defense would be to add vitamin C in those doses I mentioned. Now here's the other thing about C. It's not quite as an extreme as magnesium, but this also has bowel tolerance as a factor. So if you're adding in vitamin C and magnesium, that can contribute to diarrhea. So you have to make some choices here. C is one of those things that we can get in so many different foods too. So I recommend those on top of supplementation. And there are many different forms. Those packets over there, the Emergen-C, I think contain something like 1,000 milligrams of vitamin C to them. They have other nutrients with it. So you probably are hearing me talk. I'm very much a single nutrient person. I like to direct a single nutrient at a problem, and I avoid the multiple nutrients because that's where you get into trouble. So let's say that I had vitamin C, and it wouldn't be included with it, but butcher's broom. So I give that to somebody as an immune support, and butcher's broom is often given in that way for other things. It's not an emergency. Somebody could end up being allergic to it. So that's why and many people are. It's that yellow flower we see growing along the road. So that's why I like to stick to single nutrient therapy. Now, I would say that's a good product, but if you don't tolerate it well, there may be reasons why you don't tolerate it well. So vitamin C, an important support. We're all familiar with it. It seems old hat, but Linus Pauling was totally right. That we need this, and oftentimes we don't get nearly enough. Any questions on vitamin C? Probiotics, and this came up earlier. Biggest question I get on probiotics has a lot to do with things like, well, I take yogurt. And here's where I'm going to go into kind of a comparison here between food grade and therapeutic grade. Yogurt was never intended, and I'm not talking about special products that you might make, kefir, that kind of thing. The yogurt on the shelf was never intended to be a therapeutic dose. It was probably intended to sell more yogurt, but they also do promote live bacteria. But when we're talking about treating gut issues, reversing the imbalances in gut flora, then you want a probiotic that has a very high count. And I'm not going to say how high a count, but just a high count. And let me clarify too, with many probiotics actually need to be refrigerated, but they also can come out of the refrigerator for certain periods of time. And then that's true of certain ones like HLC maintenance or HLC intensive, the Pharmex brands, those kinds of things. So you can travel with them, so you don't have to resort to two different kinds for travel. They're very important for normal bowel function. In fact, when people get diarrhea, yeast infections, probiotics should be the first line of defense. Add them in. We're probably more familiar with what happens to gut flora with antibiotics because they kill both the good and the bad bacteria. And so even if you're on an antibiotic, you want to add probiotics in. They'll still be depleted, but you'll still get some benefit from it. Probiotics definitely help reduce gas and bloating, things that were related to poor absorption of nutrients, and they do help both constipation or diarrhea. But if you take too many probiotics, it can also cause gas and bloating. So kind of figuring out where your optimum amount is very important. And this one has so many different forms, different ways of taking it. What you're looking for are things that have lactobacillus, bifidobacteria, that kind of thing. Look at the type of organisms that are listed on the labels themselves. I like to take probiotics at night because the body is actually cleansing, but you can actually take it any time of the day. And this is one where I say, and it depends, I know, on the kind, you can take it with or without food. I don't stipulate in this case, again, kind of with thinking about things as cofactors, I would say take it with food, but to be honest, I don't see a difference at all with it.
So if your kids have poor diets, do you recommend that for teenagers, or
So,
only if you have these symptoms of gas and bloating?
So the question is, if you have teenagers with poor diets, would I recommend probiotics? Yes. This is one of those kinds of things that even if you don't have symptoms, this is important. Yeah, I would definitely recommend it. Yeah, and even more so because of the poor diets. Yeah, so many of the bacteria actually help with producing vitamin B12 and some of those other nutrients. But also, a lot of these things that I mentioned when we add in, they can also help with maintaining health. I would put vitamin D in that category, vitamin C, probiotics. Magnesium may or may not be necessary for someone on a day-to-day basis. So we're looking for optimum health at the same time.
Thank you.
Fish oil. This is the one I hear about from people when digestion isn't very good and they actually need HCl. Oh, the fish oil repeats, I taste it, that kind of thing. So oftentimes it can show up as something you're not digesting very well. And I want to just make one comment. Some of these supplements actually thin the blood, and fish oil is one of them. If somebody is on an anticoagulant, a blood thinner, for treatment of something, and I won't make a comment on that use right now, you want to be careful of some of these that thin the blood. You don't want to indiscriminately put some supplements in for that purpose. But fish oil can be used as a natural blood thinner. It actually does also help with lowering cholesterol values. It's important for cell signaling in the body. And in fact, when I'm talking about I'm talking about the omega-3 fatty acids and the two forms, EPA and DHA. And interestingly enough, there was a study that was done. Do men and women have different needs in this area? And yes, they do. DHA for most women should be the highest one on the bottle. And for men, EPA should be the highest one on the bottle. So it does matter. Does it matter to where I'd throw my fish oil out? I don't think so. But you can look and see, and there are various ones in the dispensary as well as elsewhere that have, different ranges. A typical dose that we recommend here, and I want you to, if you add this in carefully, is about a tablespoon in a liquid variety. I would say in terms of a capsule, that's harder to get at. That's why the liquids are easier to dose. But I'd say that range that's equivalent might be between 2 and 4 capsules. But you have to be careful how much fish oil you add in because it can thin the blood again. And at about 5 or 6 tablespoons, you can thin the blood so much that you actually can't control the bleeding. So I mention it is because with a combination of other things, I don't want people to get to the point where their blood is too thin and then you actually have a bleeding scenario. So be careful with these. Yes, ma'am.
If you're on a low-dose aspirin,
Okay.
should you be taking fish oil?
So the question is, if you're on a low-dose aspirin, should you be taking fish oil? My opinion is yes, because it actually is working via a different mechanism than the aspirin. But you want to see whether there's any tendency to bruising or any type of scenario that would say that your blood is too thin. But fish oil has benefits, anti-inflammatory benefits, and other things that I would say yes, but watch how much you're taking. Good point, though. Someone taking aspirin, you want to be really careful of taking anything else that acts in the same way, like ibuprofen, anything that has a similar action. Tylenol doesn't have the same problem, but many people, people with headaches, for example, they'll say, yeah, I'm taking a low-dose aspirin because that's for my heart, but I'm also taking a lot of ibuprofen. That's a good way to actually develop a problem. So, and the other thing to think about with low-dose aspirin is I know that's not the topic, but I want to mention it, is if you don't take it with food, you can actually, cause an ulcer, or definitely a bleed in the GI tract. So you want to be careful. Any other questions on fish oil? I'm going to include within fish oil is other forms of this as well. People are doing things like krill oil. I've seen squid. What's that one called? Well, a squid oil. That's not what it's called, but I'm sorry. No, the squid has another name. I'm sorry. No, it's a calamari. Yeah, I've seen that as a calamari oil. And so there are other forms, but you want to look at what the omega-3 fatty acid component is of those and the purpose for taking it.
And back to the aspirin
Yeah.
with food, how much food? Because I've been taking baby aspirin at night
Okay.
No food for years.
Okay.
For heart.
So the question has to do with.
What these supplements taste, Louise.
We're glad you're here. So the question is how much food with aspirin? Get something in your stomach that.
Crackers, a couple nuts, or were you talking like the snack or don't take them at night?
Honestly,
I was told to take them at night. Most heart attacks happen at night. Most people die in their sleep of heart attacks. So to take them at night would
Okay.
be more helpful.
So the comment was about needing to take it at night to prevent all the things that happen at night. It almost makes you not want to go to sleep, doesn't it? It's all those things. So the thing about the heart attacks is actually related to cortisol. And so cortisol rises from about 3 a.m. It's at the lowest ebb at 3 a.m. and rises in through the morning up until later in the night, in the early morning. That's what wakes us up. But that's also why the heart attacks occur then as well, and other things that are affecting the system. My opinion is you need a lot of food to prevent the effects of the baby aspirin. I would say maybe you've been lucky with it. I know people that have developed bleeding ulcers from it, so I would be careful. If you could take it with a reasonable snack at night that wouldn't interfere with sleep.
Or take it with dinner.
Yeah, you could take it with dinner.
Beneficial.
Yeah, it would be beneficial. And what it's designed to do, what it's doing is inhibiting platelet aggregation, and the platelets are what cause clotting, and so, or that they group together and can create a clot. So you could take it with dinner, no problem, because it's going to reduce that. It's not the magic of it at night. It's reducing that platelet aggregation and thinning the blood that's occurring. So, does that make sense to everybody? I should have labeled this aspirin talk. Methylfolate. Methylfolate. Let me just clarify that too. Why I use both of these here, and I did change it up there. So folic acid. Well, folate, for example, it refers to anything that's green, foliage. That's folate. So this is related to intake related to green things, and folate is derived from that. Folic acid, however, is a synthetic form of folate that is in most supplements. A couple years back, by the way, we changed out almost every supplement that's in the dispensary, except ones we couldn't get around, and I think we even got around those. So that it's only folate, the biologically active. As you get older, you cannot use folic acid very easily. And folic acid is very important for the central nervous system. It's a cofactor in the synthesis of other amino acids. It's also extremely important in reducing homocysteine. Now, homocysteine is important in biologic processes, but when it gets elevated, it implies there's inflammation in the system. So folic acid is used along with vitamin B12 to reduce homocysteine and reducing the risk of different cardiovascular health issues. So there's an inability to break down folic acid the older you get. And so methylfolate is the more biologically active form of folic acid. And so that's what you want to choose when you can do it. It's also very important in repairing DNA, and a very important nutrient in the body. I'm going to go through some of these a little quicker here, unless you have specifics. Was there a question?
Well, this is on, this one, this is on, what is it, B12.
Okay.
As far as, there's the methyl form, and then there's, this cyano.
Okay, so the question, okay.
Form. And I was wondering if you have, say, the MTHFR defect, if you take something, say, with the cyanocobalamin, is that a bad thing to do if you have that methylation defect? Like I was noticing, this iron has some extra, supplements in it, B vitamins, but they have that particular cyanocobalamin instead of the methyl form.
So the comment was on, if you have the MTHFR defect, should you be worried about methyl in other forms? My understanding is no.
Or not methyl
okay.
forms, the wrong, like the cyanide. and stuff.
So many of the different types of vitamin B12, I believe, are safe to use in any form. Many people don't like to use cyanocobalamin because of the implication of cyanide in it. We have methylcobalamin, which is usually doesn't contain any preservatives in it, and then so I choose when I can to use the methylcobalamin. And that's the one that's usually available in our multi-use file. So if you feel concerned about it, stick with the methyl form of it. But my understanding with regard to the MTHFR, which is complex, and usually only a problem when we're talking about the double allele situation. So usually the heterozygous one allele is not as big a concern, although there are people out there that would probably differ. If you have the double allele, then focus on the methyl form, I would say. It has a lot to do with clotting issues as well. That's a lot of where the understanding of MTHFR began, because I noticed women, who are pregnant were tending to clot more, and they found that became a factor. So I don't mean all women with that particular defect. Oh, did I click beyond one? I hit it twice. Oh, I can't go back, can I?
Not unless we want to erase it.
Okay, no. Let me just say, vitamin E, and I say mixed tocopherols here. Vitamin E is actually, there are 8 different forms of vitamin E. There are the tocopherols and the tocotrienols. So you want to choose something that's at least a mixed tocopherol. It used to be the vitamin E that you got was only D-alpha tocopherol. And that they found in studies that it contributed to reducing the amounts of the other levels of vitamin E. So we now have only the mixed tocopherols. It's an important antioxidant, but it does so much more that I recommend it to many people. For example, to use it topically to reduce scars, to help improve wounds, wound healing. It's very effective that way. And it should always be added in when you use fish oil, because it helps reduce fish oil or prevent fish oil from oxidizing in the body itself. I know there's a lot of controversy about vitamin E. So I don't want to address those controversies. I have seen it be very beneficial for many people. It does also thin the blood. It reduces the stickiness of platelets. So, and it's a very important antioxidant in the body. So now that I'm on the B12, the vitamin B12, and you started to answer or ask those questions on that. Vitamin B12 it plays a lot of roles, and a lot of people come in who have fatigue, who have other issues related to function, and I will add vitamin B12 in along with CoQ10 and other things that help support energy, because it actually helps improve function at the level of the mitochondria. The mitochondria are the powerhouses of the body. And so B12 can have a dramatic effect on function. I had a patient come in a few years ago, and a flight attendant getting back to work. And we really only had time to do one thing, and so we trained her how to inject herself with vitamin B12. And sometime later she called from somewhere else. She was on a long-haul flight and said, "I'm doing great," And she kept going, and I haven't seen her since. So it seemed to have been the trick. So vitamin B12 does help in support of energy. And back to the question of when to do something, I would do B12 and B vitamins early in the day, unless there were a particular reason to use them late in the day. We've also used vitamin B12 very effectively to treat bursitis. You would use vitamin B12 daily for about 12 weeks. And improved bursitis. You use it with folate to reduce homocysteine levels, obviously. the B vitamins, now you will see different supplements that are, let's say, vitamin B12 and B complex. Some of the B vitamins actually have limits on how much you can take at a time. For example, vitamin B6, in the form of B6, you don't want to take more than about 200 micrograms a day. And in some cases, you can end up with some peripheral neuropathy or numbness and tingling with more amounts. So that's why I say you have to look at supplements and don't double up on some of these vitamins. B12, on the other hand, has no known toxic level. So if you have labs done and it comes back, let's say the upper limit is around 600, I believe, and it comes back 1900, don't panic. All that means is you took some B12 today. And we accidentally did this experiment with a patient who we tested one day, and then she had other testing done the next day. She took B12, her level was 1900. The next day, her level was 600. The only difference was she had B12 today, she didn't have it the next day. It's water soluble. Yes, sir.
I'm sorry, I was writing and I missed, but don't you take more than 200 micrograms a day?
B6, vitamin B6.
200 micrograms or milligrams?
Micrograms.
Of vitamin B6?
B6, yes.
Because they're all the vitamin B complexes are 50 or...
They're actually, you're right. I'm saying that wrong. 200 milligrams. Yeah, I was thinking of another one. So the question was about how much B6 to take. Yes, 50 milligrams is a standard dose. You don't want to go above 200 milligrams. Now, sometimes you can, but if you want to take more than that, it's better to go to pyridoxal 5-phosphate, another form of it that doesn't have the same side effects. So you can take more in that case. And many supplements do contain P5P rather than vitamin B6. I was thinking, for some reason, I was thinking about selenium when I mentioned the 200 micrograms. So ignore the microgram dosing there. Question?
You mentioned something about numbness in the hands. Was that from these?
So the question, numbness in the hands, no, vitamin B6, when you take too much of it, let's say from multiple sources, it can cause some numbness and tingling, like a peripheral neuropathy. And the way you deal with that, you just back it off. But sometimes you can, when I've done supplement reviews with people, they will come in with things that have multiple levels in there, and they wonder where this is coming from. So that's one that you want to monitor more carefully. The other thing you might think about too, although it's used in many different ways, niacin, the flushing action of niacin. And don't be confused, by the way, niacinamide is not the same as niacin. It doesn't have any effect on cholesterol in the niacinamide form. Niacin is often used to actually lower cholesterol values. But the B vitamins can actually help in many ways with mood. When somebody comes in, they're having anxiety and stress, I'll add in B vitamins, and it'll help tremendously. Any questions so far on anything?
Your dosage for B12?
So the typical dose on vitamin B12, it depends on what form you're taking. Typically, though, a lot of supplements have about 1,000 micrograms or 1 milligram. You can take it in many forms up to 5 milligrams that you'll find, but if we're using it for in a multi-use vial and we're injecting, you can take almost as much as you can tolerate, depending on the reason, because there's no toxicity. But the typical is usually between 1 milligram and 5 milligrams.
And what do you mean by can tolerate? What happens if you take too much?
There's no toxicity to it at all. The way Dr. Wright likes to put it, he says the only way to be toxic on B12 is to drown in it. So I don't recommend it. Yes, ma'am.
Sorry to go back to selenium.
Okay. Okay, good question. The question was on selenium and what is the dose of selenium for Hashimoto's thyroiditis. Selenium is actually it actually helps with tonifying the thyroid gland. It is commonly used. I typically, in that case, will do 200 micrograms of selenium as a typical dose.
It's a child, 12-year-old.
Gosh. The question is for 12-year-old. I don't know the selenium safe dose for a 12-year-old. Oftentimes we talk about half the adult dose, but I'd have to check that. Dosing for children is complex depending on the individual and what other health issues we're talking about. So I don't think I'd say that randomly, but you know, if you want to, you can come up later and I'll check the dose for you on that. 200 microgram is generally, now I've checked this out in the literature, some people actually take as much as 600 micrograms, but you start to get into trouble when you get toward 400 to 600. So the safe level is considered about 200 micrograms of that. So the next one that comes up here is, I think I clicked 2 again, didn't I? So turmeric and curcumin, very potent anti-inflammatory. We know it probably from curry, the spice curry. The active ingredient of turmeric is curcumin. It does help reduce inflammation. In fact, in many protocols where we're reducing inflammation, breast health, uterine health, GI health, will add in turmeric or curcumin. In fact, one that we use often is Mariva by Thorne. I'll use that for breast health issues. Many forms that it comes in. It's a potent anti-inflammatory. Typical dosing, they're still working this out. Many of these supplements don't have doses that are studied per se for best action, but it tends to range between 250 to 750 milligrams per day that you can take. And I don't know of any toxicity of turmeric. I'll go to the zinc balanced with copper. I put this in very specifically. You know, zinc is useful in many forms, but zinc can actually cause a deficiency of copper, and vice versa. Copper can cause a deficiency of zinc. So the typical ratio of zinc to take is 15 to 1. 15 milligrams of zinc to 1 milligram of copper. That said, I've looked at many supplements, and they almost none of them are exactly in that ratio, even including some that say they are in that ratio. But zinc balanced with copper, it's a specific supplement that we have downstairs. Downstairs is what we recommend to take to avoid that deficiency. Zinc is important in so many different reactions, you know, including poor night vision, poor wound healing particularly. And zinc is really your go-to supplement when you have, let's say, a scratchy throat or cold coming on. And you want to get the zinc in contact with the inflamed tissues, and it'll help to reduce the problem. Was there a question about zinc? We use this a lot too. We'll do hormone panels, and sometimes when there's hair loss, hair growth where a woman doesn't want it, for example, even in men with prostate issues, we'll recommend zinc balanced with copper to slow that process down. So it has many different effects in different physiologic processes. Bilberry. Yes, ma'am. So the question is, do I recommend zinc supplements for hair loss? I would normally do that based on hormone testing, but yes, zinc will actually slow down the process of an enzyme called 5-alpha reductase that actually takes testosterone and some degree DHEA and sends it down a pathway more related to DHT, things that we would associate with prostate issues in men, for example. But it can also affect women. So taking zinc supplements can actually help slow down hair loss if that is your problem with hair loss. There are probably 5 different causes of hair loss well, there may be 50, but primary ones can be an imbalance in the hormones, such as I'm describing, leading to, you know, an overactive 5-alpha reductase enzyme. And so that's causing hair loss. It can be related to malabsorption of nutrients. So when we were talking earlier about digestive issues, it can be that you don't have enough hydrochloric acid, so you're not able to absorb the nutrients that you need, and thereby having hair loss. It can be related to low thyroid. Low thyroid will often affect or cause or contribute to hair loss. It can be related to poor absorption of iron, for example, which again is related back to malabsorption of nutrients. And then another one that I tend to call hereditary. And so sometimes there is just a hereditary tendency toward that. And there are many other causes. We can say alopecia, other sorts of issues that are going on. Alopecia may be meaning more a specific cause or bacteria or other problem. So, but zinc can actually work on that 5-alpha reductase problem that I mentioned earlier. Bilberry is a wonderful antioxidant for the eyes. It helps reduce inflammation. And back to the bruising, the bleeding and bruising, this is also one that I add in to help strengthen the capillaries. And again also helps with venous insufficiency. And an interesting thing, I know we're not talking about diabetes or kidney function here, but often in those that are diabetic, adding bilberry in can help protect the kidneys. Typical dosing on this one, it can vary. I've seen it as low as 60 milligrams, but typically more like 200 milligram dosing. I love its effects for the eyes. I have an interesting story of a woman who was coming in and doing some IV therapy and things of that nature. And I had her on some things, including bilberry. And she started to say, well, I look at things and they seem blurry. And that she was down in the IV room one day and she happened to take off her glasses and look at the wall and go, oh my God, I can see. So she'd been counting on, you know, her prescription and not realizing her eyes had improved based on taking bilberry. So that doesn't mean you're going to get to throw your glasses away, but it does mean it can very much help. It also can, again, improve capillary fragility, but it can also thin the blood. So be careful, as so many of these things can, in fact, thin the blood. And bilberry is actually concentrated blueberry. So, yes, ma'am.
What about dry eye? Would it help with dry eye?
So the question is, would it help with dry eye? I always throw it in as a supplement to go with that. Dry eye has so many possibilities, including autoimmune issues, but also low hormones, including low testosterone. So, there are some therapies that use testosterone, particularly as it affects women, and that can contribute to, can help. Other supplements to consider. I just put some of these things in as ideas to mull over. We've talked about some of them already. Iodine. Iodine helps with breast health, uterine health. I tend to give more iodine to women than men. Digestive enzymes for malabsorption. Alpha-lipoic acid and resveratrol, very important antioxidants. Yes, ma'am. So the question is, can iodine be beneficial to Hashimoto's? That's a very tricky question. So I tend to think yes, but it's not a good idea to add it in because iodine can actually precipitate thyroiditis. So it can cause thyroid storm. So I don't use it very often, although I'd like to in more people with Hashimoto's. So you have to be careful. I would tend toward things like more like kelp and other dietary sources with regard to that. Now, if we're talking hyperthyroidism, not Hashimoto's, which is a hypo state, then yes, iodine would be very beneficial. that'd be Hashimoto's. Yeah, I would not use iodine in that case. Selenium, yes. Thyroid cofactors, yes. Other things that tonify, yes, but not iodine. There may be certain situations where we would, but that would be case-by-case basis. So selenium, I mentioned selenium earlier. Milk thistle is very helpful for the liver, especially with fatty liver. I don't use some of these things routinely in all people, but I want you to know about them. Adrenal supports. And I put pomegranate down here. It has evidence of with helping with blood pressure, prostate issues. So it's something to consider. And I'm cognizant of the time here too. Now what I put in at the end were some recommendations for supplements for several different states. Hypertension. I use a lot of magnesium, for example, for hypertension, and magnesium oil, fish oil, vitamin E, sometimes niacin. Hormone replacement does help for some people. I'll just go quickly through. These would be more strategies you might take on with your doctor, but I want you to know about some supplements that are used in those particular cases. Now, I really like Stephen Sinatra. I have to keep from saying Frank Sinatra, but Stephen Sinatra and the Awesome Foursome, he writes about many cardiovascular health issues. This is an older book. He has a newer book out there. But he loves CoQ10, L-carnitine, D-ribose, and magnesium for the heart, and also taurine. Because they help boost heart function, support the mitochondria, and help with improving circulation of oxygen. And CoQ10, I wanted to feature that because I really like this one, or ubiquinol. The ubiquinol is the active or biologically active form of it. And I will often give it along with vitamin B12 because it helps improve the energy at the level of the mitochondria. So mitochondrial deficits are often these days a factor relating to someone having low energy. The CoQ10 also helps, again, like an antioxidant, quench free radicals. And free radicals are those things that, unless they have a match, that they can go in and they can damage tissue in various places. Oxygen, for example, even though we depend on it, if oxygen doesn't team up with another oxygen, it becomes a free radical and it can damage the cells. So everything needs a match in the body to keep it from doing damage. Yes, sir?
You have the L-carnitine here. If one takes acetyl L-carnitine, is that...
Yeah, I will often give acetyl L-carnitine as well. So yeah, I like acetyl L-carnitine for detoxification reasons too.
But can you take that, if you're already taking the acetyl L-carnitine, you don't need to take the L-carnitine?
I don't think you need to take another form of L-carnitine, no. I think you're fine with that one. You know, the CoQ10 does improve blood flow, and this is a part of CoQ10, and I'm just using CoQ10, I'm really referring to ubiquinol. It improves gum health. And the dose for that is at least 100 milligrams. And I've had a number of patients come back from the dentist, and the dentist said, gosh, your checkup is better now. It reduces bleeding if there's any tendency toward bleeding. So, and it's a documented effect that CoQ10 has. So, but you have to be at least the 100 milligram level. And some people, you can add the CoQ10 in. It tends to be a little pricey. But sometimes you can get to the point where you're taking too much. So if you could add more, see how you feel. But if you find it's keeping you up at night, then you want to back that one down. I really like this one, though, for energy and its other beneficial effects. So the next one that I have here is osteoporosis. We talked a little bit around that. I want to point out some of the cofactors, and sorry, I did duplicate a couple of things there in my haste to type these things out. You want to always take magnesium with calcium, and you want it to be at least 50% of the calcium dose. So if you're taking 1,000 milligrams, 500 milligrams of that should be magnesium. I know there's a lot of controversy about calcium, but taking enough magnesium keeps it in circulation, and so that it doesn't get deposited in places where it doesn't belong. And that's what I'll say about that here at this point in time. So if we're talking calcium balance, you want to have good digestion, because poor hydrochloric acid will affect the ability to absorb calcium. I mentioned strontium here because Dr. Wright did formulate 2 products that help improve bone health that are not drugs on the market. Strontium and calcium are next to each other on the periodic table. And so strontium gets deposited to the bone like calcium, and so that it's very supportive, can strengthen the bone without affecting it or causing it to be brittle. And you can actually use it at the same time if you're using one of the bisphosphonates or osteoporosis drugs out there. But you have to take it away from calcium. So this is one of those kinds of things. You take it separate from the calcium so they don't oppose absorption here. And then kind of moving on to the last one, on cognitive decline. Obviously, this is an important question in our culture at every level. It's suggested that by 2050, 1 in 3 people will have some form of cognitive decline, and then at a cost rivaling our gross national product. So very expensive problem, not only on a financial level, but on a personal level. And so I just addressed a couple of things here, but in particular to highlight the Sage Memories, the product that Dr. Wright formulated, but based on very sound science of the use of niacinamide. Remember, it's a vitamin B3, but it's not niacin. It's an amide form of niacin, lithium, turmeric, and resveratrol. Actually, excuse me, resveratrol is not in that product, but it contains rosemary and sage. Niacinamide can penetrate the blood-brain barrier, and actually all of these are protective of neurons. Lithium is neuroprotective and neuroregenerative. So a very good product if, let's say, somebody is just starting to have some memory issues. But first thing to do before anything is make sure you're not experiencing nutritional deficits, problems that could be contributing. I think many people are too quick to jump to the conclusion something's wrong with them before they investigate their nutrition, their supplements, their activity level. And I think, and there is a nice study out there, if it wasn't complex, I would have brought it, but Dr. Wright did write about it. The 2 of us put an article out in Nutrition and Healing that talks about the study. It's called A Reversal of Cognitive Decline, a Novel Therapeutic Approach. And in that, well, the author of the study, Bredesen, says there are 32 methods that he wrote about in there for reversing cognitive decline. I could only count 24 in the list that were there. I think he may have alluded to them. But different combinations of supplements, brain activity, hormones, ways of eating, fasting, contributed to the reversal of cognitive decline in 9 of the 10 people in this study. It's very worthwhile looking into. I wish there was more press on it. But that's what I'm saying, is it's not a foregone conclusion that we're going to end up with cognitive decline. And that's why everything I said before is important for every one of us going forward in terms of our mental and physical health. And that's why this is important to me. The reason why I'm sitting tonight, and I've said this with every other talk I've given the last 3 years, is I had a stroke 3 years ago. And so I'm still working on recovering from it, physically very functional, but memory and health and proper brain function are very important to me. And that's why I consider it important to convey a lot of this to you, because these things are not a foregone conclusion. So, so let me just ask, did I cover at least most of the questions that people asked me prior? You know, if there are more, I can answer those after. But anything that I didn't cover that we should address now, or more questions I brought up probably? Yes, ma'am.
I have one question. Recently, I heard that you shouldn't be within like 3 or 4 hours of going to bed because at night your body needs to be healing, et cetera, and not working on digesting food. Is that?
So the question is, she heard that you shouldn't eat within 3 to 4 hours of going to bed because the body is working on digestion. I'll answer it 2 different ways. From the Bredesen study, they did recommend to people, and the age groups they were working with was between 55 and 75, with people that already had either subjective memory loss or one late-stage Alzheimer's patient. What they told them was do not eat within 3 hours of going to bed. So, and then they wanted them at the same time to have a 12-hour fast. So don't eat within 3 hours, and then have an overnight fast of at least 12 hours. That was important. But not everybody can do that because many people end up with insomnia. Let's say they wake up between 1 and 2 a.m. That's typically the waking time because their blood sugar is low. So I do recommend sometimes as much as about 100 grams. That's a very tiny amount, like the size of a chicken tender or some type of protein before going to bed if waking at night is a problem. So yes, optimally, that's a good idea, but actually it's not always easy for everyone to do. So that would be the long and the short answer of it. So, other questions? Yes, ma'am.
I was just wondering,